Well, good evening and welcome to another edition of Question Lab. I'm your host, Jeff Downing, and tonight we are going to be tackling a set of questions focused on one of your favorite topics, biochemistry. So tonight you're going to get a number of board-style questions that we are going to walk through with your special guest tonight, which is Sean Nanji. Sean, would you like to introduce yourself to the crowd?
Well, hello everyone, Sean Nanji here. I've been in medical education and test prep for about 10 years now. I've been with Rx Coach for a little over 3 years, working with students like you and coaches to help you on your academic journey. I look forward to stepping in for Faros tonight. I know I've got big shoes to fill. I look forward to our discussion here on biochemistry.
We're going to talk a little bit about Rx Coach. You know, you heard from Sean, who is the director of the program here, and in most of our question labs, we're joined by one or more of our tutors. So we're going to talk a little bit about this tonight, but I just wanted to kind of set the scene and let you know that a lot of the methods that we use here in Question Lab mirror the techniques that we prescribe in Rx Coach. So, you know, again, if this is one of your first times, or if you're, you know, in the mode of trying to figure out, well, gosh, how do I, you know, how should I attack these, you know, really complicated board style questions, or what are, you know, what are the tips that I should follow? Listen closely. We'll be sharing those as we go. So let's go ahead and get started with question number one. I'm going to reveal the first question, and what you're going to see is that something's missing. And what's missing? Obviously, the answer choices. So again, for us, we really we hammer home the idea that you need a methodology, and as part of our preferred methodology, we tell you to cover up those answer choices first. And the reason is because if you see something within the answer choices that you're unfamiliar with or that you don't feel confident about, it can easily rattle you. And there's no need to get rattled. You want to be able to take this methodically. So we say cover up those answer choices and then read the lead in. And that is the question at the end of this. So we start by reading the lead in, and then we go back to read the vignette. Then we read the lead in again, and then we'll get into the answer choices a little bit later. Okay, so that's those are the steps that we take. So let's go ahead and get started. So again, starting with the lead in, which of the following enzymes is most likely deficient in this patient? Think about what kind of information will be helpful for you in answering this question as we read the vignette. An 11-year-old boy is brought to his pediatrician by his mother because of recent episodes of lightheadedness, racing pulse, dizziness, and nausea. On physical examination, there's generalized decreased muscle tone, and the liver and spleen are palpated a few centimeters below the left costal margin. Laboratory studies show increased creatine kinase and decreased glucose levels. Urine ketones are positive with negative glucose. An electromyogram shows features of myopathy. So again, the question, which of the following enzymes is most likely deficient in this patient? Think about this. Think how many steps it will take you to solve this one. And you can go down to the question box and enter your answer there as I pass it over to Sean.
Well, thank you very much, Jeff. So we've gone ahead and highlighted here what we think are the important clues in the lead-in and vignette. So in the vignette, the first thing you're often going to get in these questions are the demographics, right? So in this case, we know it's an 11-year-old boy. So automatically, we know that this is more of a pediatrics question, and our thought process should start to hone in on that. Then they'll often tell you why the patient is coming in to see the doctor or why they're going to the hospital. In this case, it's because of lightheadedness, racing pulse, dizziness, etc. So you want to make note of those presenting signs and symptoms. They may also give you duration of how long it's been going on for. Is it more of an acute issue like hours to days, or more of a chronic issue like months to years? Now, they also give us some important physical exam findings, notably some abnormal findings. You always want to make note of any abnormal physical or lab findings like we've highlighted here. Now, in the lead-in, this question is asking about the enzyme that's most likely deficient. So how many steps is this? Well, one, I think we need to figure out the diagnosis and condition. And then step two, we need to figure out what the enzyme problem or deficiency is. So this is likely a two-step question here. So let's take a look at those answer choices. And when we go through the answer choices with students, we recommend starting at the bottom and working our way up to the top. And the reason we do that is because we don't want you to see an answer choice that you're unfamiliar with that may cause you to, panic on test day. But in this situation, when we go bottom to top, is because we don't want you to prematurely start at the top, select an answer without going through all of the answer choices, right? So this kind of forces you to go through all of them. So let's start with E and work our way up. E, mycophosphorylase. D, lysosomal acid maltase. C, glucose 6 phosphatase. B, debranching enzyme. A, branching enzyme. So we're going to go ahead and open up the poll and let you guys select what you believe is the correct answer.
That's right, and that's what we've done. We have launched the poll. The poll is now live. Which of the following enzymes most likely deficient in this patient? Go ahead and make your selection. Now, again, you're going to hear us. We repeat this every week, but you never want to leave a question unanswered on test day. You're not going to be penalized for it, or at least for wrong answers. And we definitely want to make sure that you're participating fully in Question Lab. Put yourself out there. Take your shot. Let us know what you think the answer is. And it's interesting looking at the numbers. About half of you have voted. Not seeing a real consensus forming yet. So this should be an interesting one. Okay, I'm going to give you a couple more seconds, and then we're going to close the poll. So go ahead, make your choice. Get it. Okay, great. Well, like almost over 3/4 of you have voted, so I'm going to close the poll. And we're going to share those results. So looks like an interesting mix here. So again, the debranching enzyme was the leading vote getter, with glucose 6 phosphatase right on its heels, and a lot of you went with answer E, mycophosphorylase. So this is an interesting one. So let's go ahead and we're going to hide those results and reveal the answer. And the answer to question number 1 tonight is answer choice B, debranching enzyme. So congratulations. We call that a win since this was the leading vote getter. But I know a number of you may have picked a different option. That's okay. We're going to help you understand. So Sean is going to break it down for you. Sean?
Well, thank you very much, Jeff. So let's take a look. So this patient likely has Cori disease, which is glycogen storage disease type 3. And we know that based on his episodic hypoglycemia. It's not just hypoglycemia, right? It's episodic hypoglycemia. He's also got ketones in his urine. He's got enlarged liver or hepatomegaly. He's got hypotonia, and he's got increased creatinine kinase. Now, this disease can be distinguished from glucose 6 phosphatase deficiency by its hypotonia, weakness, wasting of skeletal muscle, and occasional involvement of the heart. And Jeff, if we move on to the next slide here, we've got a nice table that kind of breaks down these glycogen storage disorders. And if you look here under Cori disease, you'll see here hypoglycemia, hepatomegaly, muscle wasting, and heart involvement, right? And so that's what we're looking at here. If you look at glucose 6 phosphatase deficiency, you're going to see, a different set of symptoms here. So we want to, keep those symptoms straight and not make a mistake by forgetting those little details, which can be easy to do with these glycogen storage diseases. So there's an easy way to remember this. If you remember the A, B, C, D, so A for Anderson, B for branching enzyme, C for Cori disease, which is debranching enzyme. So Anderson disorder, that's branching enzyme, Corey disease, D branching enzyme, A, B, C, D, a little mnemonic there for you to keep that straight. So let's go ahead and go back to the previous slide. So we talked about why D branching enzyme is the correct answer. Let's talk now about why the other answer choices are less correct. So E, we'll start at the bottom, of course. Mycophosphorylase deficiency, that leads to McArdle's disease, and that's glycogen storage disease type 5. And that's mainly going to present with muscle cramps, fatigue, and myoglobinuria with strenuous exercise. And you will have heart involvement and arrhythmias, but that's due to electrolyte abnormalities. So it's a little bit different in this case. Answer choice D, lysosomal acid maltase deficiency, that's Pompe's disease, and that's glycogen storage disease type 2. And that leads to hypertrophic cardiomyopathy. And the way I remember that is Pompe's kind of sounds like pump. Heart is the pump of your body. So it gets to, it affects your heart more. So hypertrophic cardiomyopathy with Pompe's disease. That will lead to hypotonia as well, exercise intolerance, and early death. C, glucose 6-phosphatase deficiency. We talked about von Gerke's disease. That's a glycogen storage disease type 1. And that disease will present normally in infancy with severe fasting hypoglycemia, increased blood lactate, triglycerides, and uric acid levels. It does not show those things here in the muscle findings that we see in this patient. So, you know, fasting. In this case, we're looking at A. Let's look at A real quick. We already talked about B and D branching enzyme, why that's the correct answer. We said that's Corey's disease. A is branching enzyme, like we talked about a mnemonic A, B, C, D. Anderson's is with branching enzyme. That's glycogen storage disease type 4. And that also presents usually in infancy with hepatosplenomegaly and failure to thrive. And children with this disease usually have dilated cardiomyopathy and cirrhosis, and they die within 5 years. And this patient's 11 years old. So this patient is not this patient's condition is not going to be caused by branching enzyme deficiency. It's Corey's disease, which is D branching enzyme. Back to you, Jeff.
Hey, fantastic. Okay, so a lot of a good substantive background there, and also some tips and tricks for remembering these. So make sure you understand your glycogen storage diseases before you go into step 1. Let's get into question number 2. Again, we are going to start this one with the lead-in and take it from there. Which of the following molecules is most likely increased in the serum of this patient while taking this medication? So we've got a medication question here. Look at this. Look at the variables as we read the vignette. A 54-year-old man comes to the physician with worsening of his chronic osteoarthritis pain. He is taking an over-the-counter medication, which, if overdosed, may cause combined metabolic acidosis and respiratory alkalosis. Again, which of the following molecules is most likely increased in the serum of this patient while taking this medication? How many steps do you think this question is going to take before you can get to the answer? Let us know in the question box. I'm going to turn it over to Sean. Sean?
Well, thank you very much, Jeff. So we've gone ahead here on the next slide and highlighted what we think are important clues in the vignette and lead in. So with the vignette, once again, demographics, right? We've got a little bit of an older patient. He's 54 years old, and he's coming to the doctor because of osteoarthritis pain, and it's chronic. They tell us it's chronic, right? Now, it's a short vignette, so each clue is going to be that much more important here. Now, we know from the lead in, they were referring to a medication. So it's going to be important to pick up on any clues that could help us figure out which medication it is. Now, in the lead-in, they're asking about molecules increased in the patient's serum while on this med. So a few steps here. First step, what's the medication? 2, what does the medication do mechanism-wise? And what substrate or molecule may be increased as a result of that mechanism? So 3 steps here. Let's take a look at those answer choices. Once again, we're going to start at the bottom and work our way up. E, thromboxane A2. D, prostaglandin E2. C, prostaglandin D2. B, prostacyclin. And A, leukotriene B4. So we're going to go ahead and open up that poll and let you lock in your answers.
Yeah, the poll has been launched. So go ahead and answer the question. Let us know which of these molecules is the magic molecule. which one do you think is most likely increased in the serum of this particular patient while taking that med? So yeah, there's you know, you kind of think about these these types of questions. You're going to run into a number of them here on step one. Um, uh, but it's a three-stepper, right? There's a lot that you need to be able to unwind and break down when you're seeing this. So this is really part of the reason why it's important to have a methodology, important to have sort of a regimen as you're working through these, because um, it will allow your brain to focus on the facts in front of you, right? Breaking down these challenging questions rather than thinking about all of the different steps you need to take in order to get it right. Okay, let's see, about almost 3/4 of you voted. I'll give you a couple more seconds here. And looks like we've got a couple of candidates. One is starting to pull away, so let's go ahead and close this poll and share the results. So leukotriene is the leading vote getter. Over a third of you chose that one, but quite a few of you also thought prostaglandin E2 was reasonable. So with thromboxane A2 also in the mix. So let's go ahead and hide the results, and we're going to go and reveal the answer. And what do you think? The answer to question number 2 is answer choice A, leukotriene B4. Nice work. So once again, the crowd has identified the correct answer, but it wasn't overwhelming. So there's quite a bit to sift through in this one. So we're going to let Sean start that right now.
All right. So step one here, we got to figure out what this drug adverse effect is. So definitely another challenging question. So this patient is likely taking aspirin, and that's used as an anti-inflammatory and analgesic medication. And if you overdose on aspirin, it may cause a combined respiratory alkalosis and metabolic acidosis. Why is there a respiratory alkalosis? Well, that's due to hyperventilation from stimulation of your central nervous system respiratory centers. And you get the metabolic acidosis because of lactic acidosis. So if you look at the next slide, we'll see here that aspirin is a non-selective, irreversible cyclooxygenase or COX inhibitor. And if you look here, COX normally functions to convert arachidonic acid to prostanoids like prostaglandins and thromboxane A2. And if you block that pathway, it causes buildup of the substrate arachidonic acid. And that is the substrate for both lipoxygenase and COX. And so that results then in the increased production of leukotrienes, such as leukotriene B4, C4, D4, and E4. And that's why leukotriene B4 is the correct answer. So now let's look at the other answer choices. If you look at all the other answer choices, starting from the bottom, working your way up, right? Thromboxane A2, prostaglandin E2, D2, right? All of the other choices listed, they're all products of the cyclooxygenase pathway, and this production will thus be inhibited by aspirin. So we're going the wrong direction there. So the only correct answer that fits the situation, that's part of this pathway, is going to be leukotriene B4, because that's the only one that will result in increased production as opposed to decreased production as opposed to the other answer choices. So great job, everyone. Let's keep it going.
Yeah, nice work. This is, again, these are some tough questions, especially if it's been a while since you've been, studying biochem, and when you're kind of mixing up all of the different, you got a little MSK in here, you've got pharm, you've got biochem. Always good to be able to put these together in a smart, rational sequence. So again, this image is on page 498 of the 2022 edition of First Aid. So quite a bit that you can pick up from this illustration. So we are at the halfway point of tonight's question lab. We do have a raffle that we're going to hold at the end of tonight's session. So hang on, and you're automatically entered into that raffle, but you do need to be here in order to win. Again, we talked a little bit about RX Coach. RX Coach is the tutoring service developed by Scholar-Rx, USMLE-Rx, and the team that brings you first aid. So, the 30 plus years of experience that we have in preparing students for the board exams, specifically Step 1 and Step 2 CK. This is what we put to use in RX Coach, and we've created a program that has helped hundreds of students perform their best on the boards. It starts with a 160 question assessment, and we use the results of that assessment to see how you're doing. Where are your strengths? Where are the areas where you're challenged? And then we work with you to develop a personalized study plan. That study plan then becomes the playbook going forward, and your coach is the one that's helping you through this playbook. So it's a one-on-one approach. We pair you up with one of our highly trained certified tutors, and they work with you to help you achieve your goals. On top of that, you also get access to all of the great USMLE-Rx products, which includes RX 360 Plus and RX Bricks and Step 1 QMax, or if you're studying for CK, Step 2 QMax. So again, we have the tools and the methods that will get you to where you want to go. So what I want you to do, if you're thinking about that, to go to www.rx-coach.com. We'll put that here in the chat for you. And what you can do is you can go over there and set up a free consult and just learn a little bit more about the program. And if you find that this is what you need and that you see the benefit of working with one of our world-class tutors, we'll set you up on a plan geared for success. So again, we've got the link there. Be thinking about that, especially if you find yourself at a point where you're not quite on track, or you feel like you're spinning your wheels. We're here to help. Okay, with that, let's go ahead and move on to our next question of the night. Again, we're going to go through 4 questions. This is going to be question number 3. If anybody is, 2 for 2 tonight, let us know down there in the question box. I'd like to be able to tip our cap to those of you that are killing it. And we're going to go and open this one up. This is question number 3. So you can see we've got an image embedded. So let's start with the lead-in. Which of the following enzymes is most likely deficient in this patient? So take a look at that patient. Take a look at that face, and let's read the vignette. A 6-month-old boy is brought to the office by his mother over concerns of a developmental delay in foul-smelling wet diapers. Pregnancy and birth history are unremarkable. The baby and his mother immigrated to the United States from Russia 1 month ago. On physical examination, the patient has a social smile but does not hold his head up on his own or make babbling noises. Brisk reflexes are noted in the upper and lower extremities. Skin examination is shown in the image. So once more, which of the following enzymes is most likely deficient in this patient? Go ahead and let us know how many steps you think this one will take as I turn it over to Sean.
Well, thank you, Jeff. So on the next slide, we've gone ahead and highlighted what we think are important, the important clues. So once again, now looking at demographics, we've got a 6-month-old, so another pediatric case, and he's being brought in because of issues relating to developmental delay and foul-smelling wet diapers. So in these young infant questions, especially when they're talking about biochemistry, you want to make note of things like vaccination history, where were they born, prenatal care, how they're meeting their milestones. and any abnormal physical exam findings like we highlighted here. So it's asking about the enzyme that's most likely deficient. So how many steps? Well, I think first of all, we need to figure out what the diagnosis and condition is, and then what the enzyme problem or deficiency is leading to that condition. So 2 steps here. So let's take a look at those answer choices. Once again, we'll start at the bottom and work our way up. E, tyrosine hydroxylase. D, homogentisate oxidase. C, dopamine beta hydroxylase. B, dihydrobiopterin reductase. And A, branched chain alpha keto acid dehydrogenase. So with that, we're going to go ahead and open up that poll and give all of you a moment to lock in your answer.
Okay, the poll has been launched, so go ahead and make your selection. Which one is the most likely deficient enzyme in this patient? Always an interesting one when you get a photo or a chart to look at. Again, you always have to kind of think about the amount of time that you actually have on the test. Especially when you need to break down a lot of a lot of different either descriptions or signs and symptoms. And step 1 has become a little bit more visual over time, a little bit more clinical over time. So this is a good question to kind of cut your teeth on. Let's see. We are about 2/3 of you have voted. I'm going to give you a couple more seconds, and then we're going to close this poll. So far, like the first 2 questions tonight, that we've got a pretty split vote here. So let's go ahead and close the poll. And let's share those results. So branched chain alpha keto acid dehydrogenase is the leading vote getter, and tyrosine hydroxylase in second place. So again, we got kind of splitting those the votes of the about 75-80% of you right there, with the top 3 answer choices. So let's go ahead and hide those results and reveal the answer. And the answer is answer choice B, dihydrobiopterin reductase. I am sorry, that is not one that I am used to pronouncing. So with that, I am going to turn it over to Sean to help us understand what happened with this one. Sean?
Well, thank you, Jeff. I think you pronounced it almost correctly, so well done there. So step 1 here, we've got to figure out what's going on. So this patient's foul-smelling odor, the rash with eczema on the cheeks, the developmental delay, the immigration history, those are all signs pointing to phenylketonuria or PKU. Now, in the United States, this genetic disorder is usually discovered at birth upon routine newborn screening, but this may not be the case in other countries. So let's take a look at the next slide. So as you can see here, PKU is most commonly caused by a deficiency of phenylalanine hydroxylase, or PAH, and that's the first enzyme in the breakdown pathway phenylalanine. And this enzyme converts phenylalanine to tyrosine, and then tyrosine hydroxylase converts tyrosine to dihydroxyphenylalanine. And both of these enzymes require a cofactor called tetrahydrobiopterin, or BH4. And that is regenerated by the enzyme dihydrobiopterin reductase, or DHPR. Absence of DHPR will result to even more devastating consequences. So this disorder is known as malignant PKU. Now, both of these deficiencies cause a buildup of phenylalanine and urinary excretion of the excess phenylalanine. That's what causes the musty odor that's associated with the disease. And you can see that part of the clinical finding listed here on that table. And our patient did have that foul odor, the eczema, and that developmental delay. So let's go back to the next slide. And we'll talk about why the other answer choices are incorrect. So tyrosine hydroxylase deficiency, well, that's associated with albinism due to an inability to produce melanin from tyrosine. And affected individuals will have white hair, blue eyes, and a predisposition towards skin cancer because of the lack of melanin, which is a protective factor. And that's not what we're seeing here, right? D, alkoptonuria, that's a disorder of tyrosine metabolism due to the deficient enzyme activity of homogentisate oxidase. And that will lead to arthralgias and urine darkening with time, but not so much the musty odor and the signs and presenting symptoms we see here. C, dopamine beta hydroxylates, that's involved in the making of norepinephrine and epinephrine. And if you're deficient with that enzyme, you're going to present with severe hypotension, hypothermia, or hypoglycemia. A, we talked about B, we know that's our correct answer with PKU. Deficiency of branch chain alpha ketoacid dehydrogenase associated with maple syrup urine disease. And that's when somebody can't break down the branch chain amino acids. So patients with this disease will classically present in the first days of life with irritability, vomiting, lethargy, dystonia, and a maple syrup smell to the urine. So once again, a little different than what this patient presented with. But great job, everyone. This was a challenging question. All the topics we've covered today are high yield biochem questions. So make sure you're keeping track of these enzyme deficiencies and how it presents in patients clinically. Back to you, Jeff.
Excellent. Thank you, Sean. Yeah, that's a key point. These may not always be the topics that you want to study, but they are important ones to ensure that you've got mastered, because again, a lot of these concepts will pop up in other areas. So excellent job. Okay, we have arrived at the final question for tonight. Question number 4. I don't know. I didn't see. No one has let us know if they've aced all of these questions tonight. So let us know if anyone has gone 3 for 3. Let us know down there in the question box. If not, it's not a big deal, right? Most these have been some challenging questions, and we're gonna see if you guys can close out strong. So what we're gonna do is we're gonna open up. This is a short one, okay? Not a ton of information. You either know it or you don't, right? So we're going to start with the lead-in. Which of the following levels is most likely increased in the cytoplasm of the affected cells? Think about that. Think about the information you're looking for as we read this one-sentence vignette. A 6-year-old boy is brought to the emergency department after developing wheezing and diffuse urticaria after a bee sting. Which of the following levels is most likely increased in the cytoplasm of the affected cells? Let us know down there in the question box how many steps you think that this particular question is, as I turn it over to Sean.
Well, thank you very much, Jeff. So on the next slide, we're going to go ahead and show you what we think is important. Once again, the demographic info, we've got a 6-year-old boy coming to the ED complaining of wheezing and diffuse urticaria after a bee sting, trying to find out what levels are increased in the cytoplasm of the affected cells. So what we have to do here, we got first step, figure out what's going on, and number 2, figure out what levels will be increased. So this is likely a 2-step question. Let's go ahead and uncover those answer choices and take a look at what we're dealing with here. So we've got E, cyclic GMP, D, cyclic AMP, C, potassium, B, adenosine triphosphate, and A, activated phospholipase C. So we're going to go ahead and open up the poll and let you lock in your answers.
Okay, everybody, the time is now. Final question here in the cleanup position tonight. Which of the following levels is most likely increased in the cytoplasm of the affected cells? Again, not a this is one where you kind of need to know what's happening here. what's happening at the cellular level. Also, what's happening with this boy. Let's see. So about a third of you have voted. So let's get in there. Enter your selections. See if you can nail it. Kind of looking at the results so far. There is a leader. I think out of all of the questions we've had tonight, that's maybe the first one where we've had one that's garnered more than 40% of the vote. Although it's oscillating, it's shifting a little bit. Okay, let's see. About 2/3 of you have voted. Give you a couple more seconds as a motorcycle passes on another sultry evening here in St. Louis, Missouri. Here in the heartland. Okay, let's go. 70% have you voted, so we're going to go ahead and close this poll, and we'll share the results. So it evened out a little bit since I made that earlier pronouncement. So looks like the activated phospholipase C and CAMP are your two leading vote getters, with CGMP right behind it. So with that, let's go ahead and hide these results and find the answer. And the answer is answer choice A, activated phospholipase C, which was the leading vote getter. So congratulations. That's going to be a win for the crowd tonight. And if you didn't get it, that's okay. If you're going to miss the question, miss it tonight. Don't miss it on test day. And in order to make sure that you don't miss it on test day, Sean is going to walk you through the explanation. Sean?
Well, thank you very much, Jeff. So, let's take a look here and see what's going on. So we've got, in essence, what they're describing is an anaphylactic reaction, right? And we have these classic symptoms of wheezing and urticaria. And that happens via activation of histamine, specifically H1 receptors. Because remember, allergic reactions are characterized by widespread release of histamine in response to antigen cross-linking of IgE receptors on mast cells. So histamine binds to H1 receptors on the vascular endothelial cells, and that causes vasodilation and increased cell permeability. So if we go to the next slide, we'll see here that these H1 receptors are G protein coupled receptors that activate a GQ subunit, which results in an activation of phospholipase C. And you can see that there, right? You see GQ, and then you see phospholipase C there in green. So if we go back to the previous slide, we'll see why that is the correct answer. And as long as you picked up on the fact that this was an anaphylactic reaction and know it's H1 receptor involved, you should have gotten that question right, okay? So, why are the other answer choices incorrect? Well, cyclic GMP, that's increased when guanylate cyclase, the second messenger system, is activated, or when cyclic GMP breakdown is prevented via a cyclic GMP phosphodiesterase inhibition. That's not what we're looking at here. Cyclic AMP, that's increased when adenyl cyclase, the second messenger system, is activated, or when a nucleotide phosphodiesterase is inhibited. Intracellular potassium, well, that concentration is primarily dependent on the sodium potassium pump. Adenosine triphosphate, well, that's increased when you have oxidative phosphorylation is increased in the cell, or when the proton gradient across the inner mitochondrial matrix is increased. So, the key here to getting this question right was realizing, what was going on, and then realizing the second messenger pathways, knowing then that if it's H1 receptor involvement, that's going to be a G protein coupled receptor that activates the GQ subunit, resulting in an activation of phospholipase C. So definitely, an involved question. You have to know some details to get that question right. But you will have questions like this on your exam. So make sure you go over these and really kind of practice it. Right. The only way to keep this in your long-term memory is to see it multiple times. That's what we recommend when people are studying for the board exams. Take out a biochemistry pathway. Review a pathway a day or every 2 days, and just the frequency of reviewing that will help you retain that memory long term. So with that, good job everyone tonight. Let me hand it over to Jeff.
Excellent. Yeah, let me echo that. Nice job, everybody. Great participation throughout. You guys were well engaged, and I know that some of this is tricky. So it's good that you were able to put in the time here and perform well. Now, give you a minute here to copy down or screenshot the question IDs from tonight's event. You can always go into USMLE-Rx and type them into the Rx search field in order to review them. So especially if you've got Step 1 QMax or if you've got RX 360 Plus, you can go in there and dig deep and get all of the information, including all of the information regarding the incorrect answers, as well as you'll be able to see the related videos and flashcards and bricks that might be helpful if you're a little bit soft when it came to the concepts behind it.